The crisis, why America is different. How much money do Americans spend on healthcare every year? Not the government, not corporations, us. The total bill is $4.9 trillion in 2023, but here's what comes directly out of your pocket. Your premiums, your taxes, your out-of-pocket costs adds up to over $1.3 trillion a year. You pay it whether you're sick or healthy. You pay it whether you're working or retired. And despite paying more than any country on earth, Americans live 2 to 4 years less than people in other developed nations. And medical bills are still the #1 reason Americans cite when filing the bankruptcy. This isn't a broken system. This is a system working exactly as designed. But to understand how we got here, we need to go back to the beginning. When was health insurance actually created? From where? Why? What was its original purpose? And what did America get wrong? The answer, it was blocked. By whom, why, and how? For over 110 years. Let's find out. Join me now as we travel 150 years back in time. We are about to face some shocking, forgotten truths. So please grab a glass of water before you continue. The birth, Germany, 1883. 1880s Germany. The Industrial Revolution is in full swing. Factories are multiplying. Workers are flooding into cities. But factory work was dangerous. Injury, illness, death. When workers could no longer work, they had no protection, no safety net, and anger is building. The Social Democratic Party, a socialist movement, is rapidly growing. 1871, the Paris Commune. The fear of revolution spreads across Europe. Germany is trembling. Conservative Chancellor Otto von Bismarck faces a choice: crush the movement or calm it. He did both. Year of 1878, anti-socialist laws. Year of 1883, health insurance. Bismarck says, the real grievance of the worker is the insecurity of his existence. He is not sure that he will always have work. He is not sure if he will always be healthy. Call it socialism or whatever you like. It is the same to me. June 15, 1883. The world's first national health insurance system was born. Workers and employers contribute together. Medical benefits for all. The goal: appease workers to stop socialism. The result: the Socialist Party became the largest party by 1912. But health insurance, it succeeded, and the world followed. The global model, how the world followed. A 140 years of progress. 1883, Germany, the first. This idea first crossed the English Channel. 1911, Britain adopts the German model. Mandatory health insurance for workers. 1948, Britain completes the vision. The National Health Service is born. Universal, free health care for all citizens. The influence quickly spread across Asia. 1922, Japan introduces its first health insurance law, mandatory for industrial workers. 1961, Japan achieves universal coverage, health insurance for every single citizen. Meanwhile, an entirely different approach emerges. 1918, the Soviet Union established the first nominally free state healthcare system. This global trend was clear. Universal health coverage became the standard. But one powerful nation stood against the tide: the United States. As of 2024, 72 out of 195 countries have universal health care. Every developed nation has it. United Kingdom, Canada, France, Germany, Japan, Italy, Australia. Except one: America. The only developed nation without universal health care. Why? The surprising beginning: America, 1910s, 1920s. America had an industrial revolution too. America had workers too. America had dangerous factories too. So what happened? The story begins in 1915. The American Association for Labor Legislation, the AALL, drafts a health insurance bill. Health insurance had started in Germany in 1883. Britain adopted it in 1911. It seemed clear that the U.S. would follow. And here's the surprising part. The American Medical Association initially supported it. 1914, the AMA supports the proposal. Leaders in the AMA write to the AALL, "Your plans are so entirely in line with our own that we want to be of every possible assistance." 1916, the AMA board approves a committee to work with the AALL. They form a united front. 1917, the AMA House of Delegates favors compulsory health insurance. But then something changes. State medical societies oppose it. Disagreement about how to pay physicians, and soon the AMA leadership denies it ever favored the measure. The missing decade, the 1920s. Most history skips the 1920s. But this decade matters. 1926, a group of experts, the Committee on the Costs of Medical Care, begins studying health care. They have worked for 6 years. 50 economists, physicians, and public health specialists. 1932, they publish their findings. Their recommendation? Voluntary health insurance, not government-run. Even this moderate proposal sparks outrage. The AMA calls it socialized medicine. The editor of the Journal of the American Medical Association calls it an incitement to revolution. The pattern is forming. Any proposal for health reform equals socialism. Now comes the real test. The New Deal. America, 1930s, 1945. The 1930s. The Great Depression hits. Millions are out of work. Social policies are urgently needed: employment security, retirement, medical care. 1933, President Franklin D. Roosevelt appoints a committee to address these issues. They draft what will become the Social Security Act. Should health insurance be included? FDR's team wants it, but they fear the AMA's opposition. Secretary of Labor Francis Perkins later explains, "It was impossible to do anything about health insurance due to the expected strong opposition of the medical profession." 1935, the Social Security Act is passed. Health insurance is not included. Roosevelt makes a calculated decision: remove health insurance to save the rest of the bill. The AMA's opposition wins. But FDR doesn't give up. 1939, the Wagner National Health Act is introduced. Another push for national health insurance. It fails. 1945, Truman takes the challenge. November 19, 1945. 3 months after the war ended, President Harry Truman sends a message to Congress. Millions of our citizens do not now have a full measure of opportunity to achieve and enjoy good health. The time has arrived for action. Universal health insurance. Healthcare coverage for all Americans. What Germany did in 1883. What Britain was planning. Initial response. The year of 1945, poll shows 59% support. Finally, it seemed possible. But the American Medical Association, AMA, they thought differently. And they're about to launch the biggest lobbying campaign in American history. The Weapon of Fear Cold War era, 1945-1965. The AMA's campaign. By 1949, the AMA launched the largest lobbying campaign in history. $1.5 million. An astronomical sum at the time. About 19 million today. Their tactics. Health insurance equals socialist medicine. Followers of the Moscow party line. They exploited Cold War fears. They claimed Lenin said, "Socialized medicine is the keystone to the arch of the socialist state." The Library of Congress later confirmed. It's a fabricated quote, a complete lie. Lenin never said this. Doctors distributed pamphlets to patients. Anti-reform propaganda enclosed with medical bills. This wasn't a PR campaign. This was war. 1945, 59% support. Continued declining every year. 1950, 24% support. From 59% to 24%. In just 5 years, the bill never even came to a vote. Truman later calls this his most bitter disappointment, but the AMA learned something important. Fear works. They would use it again. 1961, Reagan and the coffee cups. Spring 1961. The American Medical Association faces a new threat. President Kennedy pushes for Medicare, health insurance for the elderly. The AMA needed a new tactic. They hired a Hollywood actor, Ronald Reagan. Operation Coffee Cup. The AMA produces an LP record titled Ronald Reagan Speaks Out Against Socialized Medicine. The strategy: 1. Distribute records to doctors' wives. 2. Host coffee cup meetings at home. 3. Invite neighbors, play the record. 4. Send opposition letters to Congress.
My name is Ronald Reagan. I have been asked to talk on several subjects that have to do with the problems of the day.
Reagan said, one of the traditional methods of imposing statism or socialism on a people has been by way of medicine. If you don't stop Medicare, one of these days, you and I are going to spend our sunset years telling our children what it once was like in America when men were free. One of the traditional methods of imposing statism or socialism on a people has been by way of medicine. It's very easy to disguise a medical program as a humanitarian project. Thousands of doctors' wives mobilized. House by house, coffee meetings, record playing, letter writing. Tens of thousands of letters flood Congress. Medicare's first attempt is defeated. But in 1965, Lyndon B. Johnson passed Medicare, but with conditions: elderly only, 65 and over, reduced benefits, generous compensation for doctors and hospitals. It took 20 years, from Truman's proposal to a reduced Medicare. And Reagan? This campaign launched his political career. The pattern is clear. 1948, blocked with fear. 1961, reduced with fear. The same playbook, the same lies. But the worst was yet to come. The profit motive, Nixon's secret, 1971-2009. February 17, 1971. The Oval Office. President Richard Nixon meets with his aide, John Ehrlichman, and Edgar Kaiser, chairman of Kaiser Permanente. Nixon didn't know. Every conversation was being recorded. Ehrlichman, Edgar Kaiser is running his Permanente deal for profit. I had Edgar Kaiser come in, talk to me about this, and I went into it in some depth. All the incentives are toward less medical care, because the less care they give them, the more money they make. Nixon: well, that appeals to me. Ehrlichman: the less care they give them, the more money they make. Nixon: not bad.
All the incentives are toward less medical care because the less care they give them, the more money they make.
The less care, the more money. February 17, 1971. In the Oval Office, the truth was recorded. The real goal of the for-profit healthcare system, captured on tape. Nixon's tapes were discovered during the Watergate investigation. But this specific conversation, containing the core truth, was deliberately buried from the public for decades. Why? Because of this 14-minute conversation reveals too clearly the true purpose of America's healthcare system. 1973, the system takes shape. The year of 1973, Nixon signs the HMO Act, Health Maintenance Organizations. For-profit health insurance companies expand. The Kaiser Permanente model spreads nationwide. The commodification of healthcare accelerates. Patient equals consumer. Treatment equals product. Hospital equals business. Senator Ted Kennedy warns, this bill will create profit-making institutions out of healthcare. But it was too late. The pattern was complete. 1948, blocked with fear. 1961, reduced with fear. 1971, designed for profit. And the playbook continues. Now this pattern would repeat. Summer 2009. In 2009, death panels. Summer 2009. America exploded again. Town hall meetings. Shouting crowds. Obama lies, signs. Nazi comparisons. Chaos. Anger. Fear. August 7, 2009. Sarah Palin. Former governor of Alaska, posts on Facebook, "The America I know and love is not one in which my parents or my baby with Down syndrome will have to stand in front of Obama's death panel, a committee of death. The claimed government bureaucrats would judge whether the elderly and disabled deserve medical care. The truth, no such committee existed in any proposed legislation. The actual content of the bill? Section 1233. Medicare would pay for voluntary end of life, counseling between patients and doctors, voluntary counseling, and patient's choice. PolitiFact, Pants on Fire, Fact Check, Org Whopper of 2009. American Dialect Society, most outrageous term. Every fact checker called it false. But August and September, the phrase death panels appeared in the news 6,000 times. Rush Limbaugh, she's dead right. Representative Virginia Fox, put seniors in a position of being put to death by their government. Senator Chuck Grassley, we should not have a government program that determines you're gonna pull the plug on grandma. The Tea Party movement explodes. Town hall meetings become battlegrounds. Comparisons to Nazi Germany. Poll results at 85% heard about death panels. 30% believed it was true. 2014, still 41% believed it. 2019, still 38% believed it. The lie persisted for 10 years. Why was it so powerful? Debunking didn't work. It backfired. The backfire effect. Duke University study results. Fact-checking actually made some people believe more strongly, especially those with political knowledge who liked Palin. Why was this lie so powerful? If the AMA sold ideological fear of socialism in 1948 and 2009, they sold the primal fear that the government would kill your grandmother. This was no longer politics. This was a survival instinct. And this fear kept the lie alive for over a decade. People believe what they want to believe. The result? Section 1233, payment for end-of-life counseling. Removed from the Senate bill. March 2010. The Affordable Care Act was passed, but the public option was removed. Single payer was never even discussed. 1948 Moscow Party line. 1961 socialized medicine. 2009 death panels. Same fear. Same words. Over 60 years. Today's fight, Medicare for All 2016-2025. 2016, Bernie Sanders, an independent senator, runs for president with one idea. Healthcare is a human right, not a privilege. We are the only major country that does not guarantee healthcare to all people as a right. Medicare for all. Universal health insurance for all Americans. When Sanders first proposed it in 2013, 0 co-sponsors. 2017, he proposes it again. This time is different. 16 co-sponsors. Kamala Harris, Elizabeth Warren, Cory Booker, Kirsten Gillibrand, including several 2020 presidential candidates. 2019, 15 Senate co-sponsors, 116 House co-sponsors. 2022, 14 Senate, 104 House. April 29, 2025, 16 Senate, hundreds in House. The movement was growing for the first time in 75 years. But the pattern hadn't changed. President Donald Trump's official White House statement, resisting the lies of socialized medicine. The radical far left continues to push a socialist takeover of our healthcare system. Congressional Democrats want to eliminate private health insurance. Congressional Democrats want to control every aspect of your health decisions, giving power to the federal government to decide who lives and who dies. The same words. Exactly like over 70 years ago. The pattern, over 110 years. Same fear. Same words. Over a century, the lobbying machine, the numbers tell the story. The lobbying blitz. From Q1 2018 to Q1 2019, lobbying against Medicare for all surged. 2020, $713 million. Total healthcare, 2024, $388 million. Pharma alone. But numbers aren't enough. In 2024, Washington, D.C. has an average of 3 or more healthcare lobbyists per member of Congress. 100 senators, 435 representatives, over 1,500 healthcare lobbyists. They're not protecting your health. They're protecting their $100 billion in profits. Partnership for America's healthcare future. Pharmaceutical companies, insurance companies, hospital lobbies. But here's what they don't want you to know. The truth, what other countries prove. America versus the world. Let's look at the numbers. 2023, America spends $13,430 per person on healthcare. Let's compare to 3 countries. Germany spends $7,938. About half lives 3 years longer. And medical bankruptcies nearly zero. United Kingdom spends $5,493, about 1/3. Completely free at point of care, lives 3 years longer, and medical bankruptcies zero. Japan spends $5,385, about 1/3, lives 6 years longer, and world's highest life expectancy. Medical bankruptcies extremely rare. Every developed nation spends half or less than America does, and they all live longer. Americans pay the most and get the worst outcomes. Why? The answer. Remember, February 17th, 1971. Nixon gave us the answer. Less care equals more money. This is the answer. Over 100 years of lies. Over 100 years of fear. Over 100 years of lobbying. All to hide this simple truth. America's healthcare system wasn't designed to heal patients. It was designed to generate profits. Top pharma companies 2024, generating hundreds of billions in revenue. Top pharma CEOs 2024, compensation packages reaching $20-30 million. Insurance company CEOs, millions in compensation. Insurance companies maximize profits by denying claims. Pharmaceutical companies maximize profits by raising drug prices. Hospitals maximize profits through private equity takeovers. This is not a failed system. This is a successful system. For shareholders, not patients. The pattern over 110 years. What we do now. Let's see the complete pictures. 1915 to 1917, AA proposes health insurance. AMA supports, then opposes. 1920s experts recommend reforms. AMA calls it socialized medicine. 1935 FDR Social Security Act. Health insurance removed. AMA wins. 1945 Truman proposes. Universal coverage. AMA lobbies 1.5 million. Moscow party line. Failed. 1961 Kennedy's Medicare. Reagan's coffee cups. Reagan socialized medicine. Reduced version passed. 1971, Nixon Kaiser. Less care equals more money. HMO Act. Commercialization begins. 2009 Obama's ACA. Death panels. Public option removed. Reduced version passed. 2019 to 2025. Sanders Medicare for all. Industry lobbying explodes. Socialist takeover. Ongoing. The 3-step pattern. Step 1, reform proposed. Step 2, fear plus lies plus lobbying. Step 3, failure or reduction. Repeated for over 110 years. This wasn't an accident. This was by design. What we do now. First, know the truth. This story was the beginning. Second, recognize the pattern. When someone says socialized medicine, remember 1948. When someone says death panels, remember 2009. Fear is a weapon. Lies are tactics. Third, look at other countries. Germany, the United Kingdom, Canada, Japan. They pay less and live longer. Their systems aren't perfect. wait times, limited choices problems exist. But their citizens don't go bankrupt from medical bills. Socialized medicine doesn't work. 72 countries prove it works. Fourth, understand lobbying's impact. This is the real obstacle. Not the policy, not the economics. Fifth, vote. Vote for candidates who support Medicare for all. Vote for candidates who don't take lobby money. Sixth, share the story. Share this video. Spread the truth. It's time to end over 110 years of lies. Human cost, every year. Over 500,000 Americans cite medical issues when filing bankruptcy. Over 60,000 died from lack of access to health care. 85 million are uninsured or underinsured. These aren't statistics. These are people. Your neighbors, your family, maybe you. And now, what do you think? Maybe you're wondering, what can I actually do? If I knew a simple answer, I'd tell you. The truth is, I don't have a 5-step plan that fixes everything tomorrow. But I do know this: when enough people understand how the system actually works, not how they're told it works, but how it actually works, things begin to shift. Not overnight, not dramatically, but they shift. Sometimes just knowing the truth when enough people know it, that alone has power. When millions of people see through the same lies, those lies stop working. When millions of people recognize the same pattern, that pattern becomes harder to repeat. 72 countries figured this out. Some took decades. Some took years. But they all started the same way. People learned the truth, and they didn't forget it. Now you know. And the truth is, that's where every real change begins. What you do with that knowledge, that's up to you. For more information, PNHP. Where's ye? Medicare for All Act S. 1506. Share this video. Spread the truth. If you have questions about any of these topics, or want me to dive deeper into specific areas, leave a comment below. Your curiosity and engagement help shape the next videos I make. The more specific your questions, the better I can address the real issues you're facing.